Hello and welcome to Health Talk. We have with us Dr. Vinayak Senthil, a cardiothoracic and vascular surgeon with us. It's a pleasure to have you with us, Doctor. Welcome.
Hello.
So, Doctor, we were talking about preventive health, cardiac health. So, how important is preventive health for a person to analyze what's going on with him before he meets the doctors?
It's a great and a wonderful question that the preventive health is very, very important in today's lifestyle because more than 90% of the disease and the processes can be identified with some of the basic and preliminary tests that are available today. Let it be a cardiac test, let it be or be a diabetic, or let it be stroke, let it be kind of any ailments that are commonly which are there and affecting the general population. It can be definitely have some preliminary indications or markers that can tell us this can be prevented to a larger extent.
So we spoke about different tests a person has to take, Doctor. So what parameters or indicators that you would see in that test to know what a person has? And how will that affect a person's daily life as well?
See, one of the most important comorbid conditions when we talk about, there are 2 or 3 most important comorbid conditions. Out of that, number 1 comes as a diabetes. When it comes to diabetes, we have very, very simple test that to do a blood sugar, to be a fasting, and you take a sample in an empty stomach in the morning, and after having the food, 1.5 hours later you can take, it's called postprandial. So when these 2 blood tests along with one more blood test called HbA1c, that will give the glycemic control or the blood sugar level for the last 3 months to 6 months or little more than that. So that when these 3 tests are done, and it will be very, very clear, is the patient is a non-diabetic or a pre-diabetic or a diabetic. If they are non-diabetic, they can be very, very happy and they can have the kind of a good lifestyle they have. If suppose the patient falls into a category of a pre-diabetic, then probably they can modify some of the lifestyle than going into the diabetic. And once if they are diagnosed diabetic, it's most appropriate for them to take the necessary further blood test and assessments, to take necessary medications so that to prevent them from going into the complications of diabetes. So having a good glycemic control, there's a blood sugar control at an appropriate level, will help them not to get it, or if they have a tendency to get it, or if they have it, to get effectively treated so that to prevent the complications.
So what parameters or factors do you see in these tests, Doctor, to see whether a person is a non-diabetic or a pre-diabetic or a diabetic person?
That's what I said. You will take a fasting and a postprandial blood sugar along with HbA1c. These are the markers and indicators. What is the status of a patient with the blood glucose level for the past more than 3 to 6 months or the current situation. So with this, we'll be able to come to a certain level of a conclusion to advise them and to tell them, or if required, treat them appropriately with these parameters.
So from which age do a person should start taking these tests regularly?
Now, there are a lot of parameters available in that. If suppose, normally we say after the age of 40, the chances of a person getting a diabetes or hypertension or any other comorbidities are very high. So that we generally recommend to take one masteral checkup that comes with all blood parameters or complete blood count, LFT, RFT, and also about the thyroid function test, and with an ECG, with a chest X-ray and ultrasound of the abdomen, will give us more than 90% of the parameters that you're looking in the patient. Along with that, today it's recommended to know the vitamin levels, especially vitamin D, calcium, vitamin B12, and those parameters, inflammatory parameters like homocysteine, and also apoprotein A and apoprotein B. And those levels will fairly indicate us that what is the kind of situation the patient is in the background and his health status and his health check, so that this will help us to understand what is he into the level, and able to, based on that, we will be able to advise him appropriately.
So you spoke of LFT and RFT, Doctor. So could you elaborate on that for me, please?
Yeah. LFT means it's a liver function test. I mean, how is the liver working today? I mean, what is the kind of, because whatever the patient takes the food, it gets absorbed into the gut and then it goes to the liver. And all that nutrients gets metabolized, yes, into the liver and gets stored in different aspects in the liver, and those which are not required have been excreted in the bile into the common bile duct and into the duodenum and gets excreted in that way. So the liver plays an important role in metabolism. So when you have to know about the liver function, And it's very, very important to know about the status of the bilirubin, status of the enzymes of the liver, status of the protein status of the liver, so that this gives us a fairly an idea how good is the liver function is all about. And along with it, a test of an ultrasound will tell us is one of the common parameters in the factors today because of the lifestyle is the fatty liver. When a fatty liver is a grade 1 or grade 2 or grade 3, there is no fatty liver. And along with the liver enzymes, is it elevated or normal? This will give us what is the kind of a liver function is in. If suppose the patient is on a fatty liver, most of the ultrasound screening get a fatty liver these days. And if this is a fatty liver, we can advise. So these are the foods you need to avoid. This is the food you need to take more. So these are the detox things on the food they can be recommended for you to take it. And in case of supplements or liver supplements that could enhance, yes, and to bring down, in case if you're able to possible to bring down to status 2, fatty liver to 1, or you have a tendency to go for fatty liver or steatosis, then how to avoid and how to prevent it. So the liver function test fairly gives us a good idea, especially whenever we encounter a patient in alcoholics. When we encounter, we have to look into the liver function because the liver enzymes might be elevated. The liver derangement could be there. There could be a cirrhosis, a micronodular or macronodular type of cirrhosis. And then it's helpful for doing an ultrasound imaging to know what kind of a liver parameter they have along with the enzymes. Is he jaundiced or not jaundiced? Bilirubin will tell us is he jaundiced or not jaundiced. And also liver enzymes, especially there's an enzyme called GGT, gamma glutamyl transcriptase. These enzymes will be more in alcoholics, so that when we see this parameter, we will tell them, stop drinking. If you drink further, you will not live and you will die because the alcohol is going to affect the liver directly and it is going to cause liver function and liver failure, and then it can cause cirrhosis, and then it can cause portal hypertension, and eventually you will end up in vomiting blood. Is that the way that you want to have a life by drinking this alcohol? Stop alcohol immediately because your liver function is not good. So these are the indications of the liver function that we are looking in.
So we are talking about preventive health, doctor, and you spoke about foods regarding the liver. So what are the eats and don't eats when it comes to your liver health, doctor?
Whenever we look into the liver, the most important is the fatty food, and that is the deep fried food and the junk. And today is not in the fatty liver is seen in adults. Today the fatty liver is seen in children because today they go to a ready-made burger. There are a lot of burger shops are available for ready-made burger. Along with that, they take a aerated drink, and they have the chicken made in home or not very tasty to the kids and the adults. They go to especially deep fried chicken in branded shops, and all those, the French fries, all those that looks very attractive and fancy for the kids and adults, it's all going to harm the liver. And any deep fried items, processed food, stored food, all these are going to affect the liver to a greater extent. How you can prevent it? Take fresh fruits, a fresh salad and a fresh fruit veg salad per day, and a detox drinks, the drinks which are made of celeries, which are made up of beetroot, apple, carrot, all those which are available in day-to-day practices in home, that could be taken inside. It's going to protect the liver. One simple remedy is all the ingredients in rasam. Yes, your grandmother, your mother, all have practiced. The rasam has so much of ingredients that will detox the liver every day. So, you need not search anything beyond that to have a cup of rasam every day. There is a detox to the liver.
So, we know that liver is an important organ now, from what you said. What other organs are people not taking care of when it comes to preventive health, doctor?
Yes, one of the most important things I want to talk about is the renal function test. The renal function test, because any pain anywhere in the body, for a headache or a joint pain, any pain, they go to the over-the-counter to a medical shop to just take a pill. They want just, I want this, the pain here, pain in the headache and all that. And the shopkeeper gives a pill and they put it across. See, for common ailments and the pain and everything in the body, when you start consuming these drugs, what happens is going to go straight direct affect the kidney. So you need to be very sure that you need to take plenty of water. The recommended water per day is minimum of 3 to 4 liters per day. So minimum of 3 to 4 liters of water you sip in. You keep on sipping in. So you keep on sipping in. It's going to drive all the toxins out. So all the toxins which are going to be the excretes to be excreted, and it be the patients, some ailments could take a lot of medicines. Those medicines can be out by taking more water. So renal function test can be assessed in a preventive health care with the help of the creatinine, the urea. These two parameters will give how good the kidney function is all about. And also you can measure the GFR. eGFR can be measured with the blood test. So this can give you about the renal function test. An adequate renal function test is very, very important for a healthy lifestyle. And more salt, and again I'm saying more deep fried and salted food, yes, is going to affect the kidney. So everything has to be appropriate level. Everything has to be on a normal level. So anything on a higher quantity, and especially I am talking about for common ailments and the pain and all that, getting on more of medicines into body is going to affect the kidney. Today, very young patients are into dialysis. That is because most of the thing when we see, go back into the history, there are a lot of painkillers, analgesics they have taken that have eventually have given pain relief temporarily and has caused a permanent renal damage. So be thoughtful. If you have severe pain, then take one and stop with that and see why they're the cause of pain and treat that first, rather than just giving medicines and just have a temporary cure and to affect the renal at a later date.
So renal means kidney, right, doctor? So how can urine colorations or urine texture help analyze the average person to know whether he should come to the doctor or not? So how can that be?
Yes. See, the urine color has to be a straw color. In case it's too yellow, then patient could have been suffered from jaundice, or even too yellow, it could be common, less intake of water. Probably people will have less than a liter of water and the urine will be dark, and it will be dark yellow, and this is the color of the urine. If there are 3 to 4 liters of water is taken per day, then the urine, yes, could have a good flow, it can drain out a lot of toxins, and it will be normal. But the indicator is this, the indicator is too much of froth in the urine, in the sink. Yes, there's some protein can go in, so you need to come to the doctor. If there are too much of frequency, mean every 30 minutes or every hour, and the patient is going to go pee and is going to go to the restroom, then he has to say increased frequency. Could be because of a urinary tract infection, or could be because of diabetes, or there is a burning along with urination. Then could be an infection. Go to the doctor. Check the urine test done. So that all this can help you to prevent a major complication coming out of the renal.
And what are other indicative factors that a person can just see in the mirror and know that he should visit a doctor, apart from urine and other?
See, looking at a mirror, how fresh you are, how good you are, how energetic you are, how enthusiastic you are. And if the person have a lemon yellow eyes, see the eyes are lemon yellow, then probably you could have a liver problem, could have a jaundice. Or if a patient is pale, looking at a mirror, a men or women looking pale, the tongue looks pale, the eye looks pale, then anemia could be a problem, looking at a mirror. And when looking at a mirror, you feel very tired, could be anemia, could be, and you're not able to walk, you're not able to climb the stairs, you need to check your heart. Yes, so a physic, one herself or himself could look how healthy they are, how energetic they are. If they feel no, something is wrong, and my mind is a little fogged, I'm not able to think clearly, I'm very tired, then it's good to go and see a doctor and to get advice from him, to get a basic preliminary health check, and to know the basic parameters and to know what's happening within them.
So we spoke of what can happen when you miss out on all of these. So what are daily practices a person can follow, apart from food habits and exercises, a person can follow to make sure that the liver is healthy, the renal functions are good as well?
The most important thing to be healthy is every day walk in the morning for a minimum of 30 to 45 minutes. Get up in the morning, freshen up, go for a walk. And go for a walk with your friends. And when you go with friends, you'll not know the time that it takes for you to walk. And you could share relevant information with your friends. You can share and you can get some information from them. So you have a beautiful, see, that gives us to one is a physical fitness and other is a mental fitness. Being with friends and being with a good group of friends with you. And during a morning walk, you go around and be back. And then what you can do is take plenty of water. And you take one fresh juice in the morning and a fruit juice a day. You look really, and especially the lime juice or a Mozambique juice, that makes you really fresh in the morning. Yes? Then get on to your correct spaced meals. Morning, say 8 to 9 o'clock, you take your breakfast, or the lunch you take from, say, 1 o'clock to 2 o'clock, and the evening 7 to 8 o'clock. You don't skip the timings. Take it appropriate time. and take a balanced nutrition. And if you take a balanced nutrition, then to have the exact amount of carbohydrate, the exact amount of protein and the fat with the essential minerals, yes, that could make your health very good and fit. And also a lot of lifestyle modifications that we'll be talking about later of part of our discussion. And this could make you really, really fit and healthy.
So I think just to summarize, a person should eat healthy, should avoid alcohol at all cost.
At any cost.
At any cost. And also to make sure that he focuses on his LFT, the liver functional test, the renal functional test. And it also matters a person looking in the mirror and seeing what he is. Yes. And I think on further discussions, we can talk about cardiac health. We can also talk about lifestyle modification as you revealed also.
Sure.
So thank you, doctor. We'll continue further episodes.
Thank you.